Let's take a closer look at what healthier means. That begins with examining where we are now. Joining us to discuss that topic, Paula Morgen, Director of Community Health Improvement for ThedaCare. Paula, thanks for being with us.
My pleasure. Thanks for having me.
Now, this conversation starts with establishing some of those deeper understandings of health status in our communities. So can you tell us about that process?
It starts with community health needs assessment. And I'm not sure many people know this, but all nonprofit hospitals across the country are required to do a community health needs assessment every 3 years. And the intent is just to understand what the needs are in our community so we know what to focus on.
So it seems really simple that we're doing this, but this is such a complex topic and lots of different things that are going into these community needs assessments, right?
Definitely. And it all starts with our mission. And I think most people know that our mission used to be focused on just health, improving the health of our communities that we serve. But we've, in recent years, added the notion of well-being, the concept of well-being. And people generally understand what health means. I mean, you can look at BMI scores or incidence of heart disease and those sort of measures and understand health. But well-being is a little bit more nebulous. And well-being is really about your self-perception. Am I living my best possible life? What we found was that about 53% of our region across the ThedaCare service area is thriving. So they feel they're living their best possible life. And maybe the more important piece of that is that they're hopeful. They're hopeful about the future, not just about today. So that's about 53%. Mm-hmm. On the other end of the spectrum is 5%. 5% say they are not living anywhere close to their best possible life today, and they're not hopeful about the future. And then everybody else is in that space that we call struggling. They're having a little bit of a hard time in trying to make it today. The bottom line of all that is that about 50% of the people that we serve are in that space of either struggling or suffering.
Oh, those are really sobering numbers for us. What are the things that you're noticing are the top health needs and priorities?
Yes. There's really 4 things that we're going to be focusing on over the next 3 years. So this plan is 2023 through 2025. One of those priorities is structural, meaning that we're really looking at the systems in our community that are addressing it. So what we're focusing on is alignment, so that we pick priorities and we develop processes where the other health systems in the area and public health departments and nonprofits and the federally qualified health centers in our region, that we all go through that process together and we pick common priorities and work on some strategies together. And we'll have so much greater opportunity to have impact if we can do that. So that's a little bit more of a structural opportunity. And then there's 3 issues that we are going to be focusing most of our energy on. Certainly mental and behavioral health, absolutely top of everybody's list, especially coming out of the pandemic. So that clearly is a top priority area. Early childhood, just understanding that if we can take care of the youngest and get them off to a good start from a health perspective, then we have, hopefully will prevent many other challenges downstream. And the third area then is social needs, transportation, housing, food insecurity, those sort of things, getting those needs addressed for our patients.
Wonderful, Paula. Thank you so much for your insight into where we are right now and then maybe what the future holds.
You bet. My pleasure. Thanks for having me.